Your husband has had throat surgery and is unable to speak for a while. You, his wife, have graciously volunteered to tell his story. So please go ahead.
In the spring of 2014, my husband Sheldon began to have a lot of pain and restricted movement in his right shoulder. He went to see an orthopedic surgeon. They took x-rays, did an MRI, and then for the next 4 or 5 months they administered shots and had him take meloxicam, 7.5 milligrams. But the shoulder didn't improve. Finally, he was told nothing could be done to improve his shoulder except to take drugs for the pain. His primary care physician said he didn't want him to take meloxicam because it was too dangerous on a regular basis. He suggested getting another opinion and sent him to see Dr. Prodromos. Dr. Prodromos looked at the x-rays, the MRI, and said he could not see any reason that his shoulder could not be surgically repaired. He performed the surgery, which included 5 different procedures, and this was followed by several months of physical therapy under Dr. Prodromos' guidance. Today, the shoulder is completely back to normal. He has full use of it, full range of motion, and doesn't have any pain.
Your father tore his rotator cuff in Puerto Rico and wound up coming to Chicago where I repaired it. Can you tell me the circumstances around how he happened to come here to have that done?
After a few opinions in Puerto Rico, it seemed like they wanted to put a prosthetic shoulder on my father. And, I was a little bit concerned about that with my father. And I said, why don't we get a third opinion here in Chicago? After we met with you, my father felt very comfortable with the opinion. And it seemed like a safer procedure and a lot more simple. Based on the explanation. The explanation was really thorough, so it gave us the confidence to go ahead and proceed.
When he went back, which was a little more than a year ago, he was functioning well. How is he doing now?
He is doing fantastic. He's back climbing trees, believe it or not. I told him be careful, for him to fall off again. He's not young, right? He's 66 years old and thinks he's a kid. But he's doing really well. He uses his arm for everything. He's been working on his home. So from what I understand in his explanation is he doesn't have the pain anymore.
You had rotator cuff surgery for your right shoulder elsewhere last year. I think you said that you had persisting pain afterward that didn't go away. Is that right?
Yeah, that's right. It was a very, very bad pain night and day, but the worst, it was a night.
When I saw you, we found that unfortunately it had re-torn from the surgery elsewhere, so then I did a re-repair of it in June, so this is now 3 months after the new repair. Can you tell me how it feels now?
It feels a lot better. I had no pain. I'm not suffering any pain at night anymore. I can do a lot of things with my arm now. And before this surgery on June 25, I could barely move my arm.